Welcome back to the channel after a long weekend. Let's start. We'll continue with the signs and symptoms of OAC and OAF. Okay, let's start today's class. Okay, I have drawn this flow chart in which we'll be able to understand what are the signs and symptoms of OAC and OAF. Suspicion of OAC, Valsalva result, bubbling of blood from socket. Okay, this is called Valsalva method or Valsalva results. Blood trickling from the nostril, sudden loss of toothpick of a socket. Okay, from a socket. Now, this is the confirmation of OAC, that oro-antral communication has happened. Okay, this is the confirmation of OAC that oro-antral communication has happened. Now, other symptoms which are associated are severe pain, okay, in the area, epistaxis, that is bleeding from nose, altered nasal or vocal resonance, and unilateral nasal obstruction. These are associated with other symptoms like severe pain around the area, epistaxis, altered nasal or vocal resonance, and unilateral nasal obstruction. What are the signs and symptoms? Air and fluid passing into the nose, sinus and mouth, foul odor and taste, unilateral nasal discharge, especially after drinking. Okay, we do that clinically in patient. Regurgitation and sinusitis of the affected site. When we have to check OAC, we do this procedure in patient. We ask patient to drink water and see if it's coming from nose or not. Okay. Then if it is associated with all these symptoms, then there is acute OAC and OAF. And if symptom had resorted to the later stage, that is, it is associated with negligible pain, there is antral polyp, sometimes suggestive of malignancy, there is hoarseness of voice, and there is nocturnal cough and earache, then it has turned to chronic OAC, that is long-standing OAC, that is OAF, that is oro-antral fistula. Okay, this sign and symptom is the establishment of OAC. This is the symptoms of OAC and present with these symptoms. If these symptoms are not present, then it has reached the severe stage with these symptoms. And if this symptoms is present, this is an acute OAC. And if these symptoms are present associated with this has a chronic OAC or OAF. Okay, so these are all together signs and symptoms of OAC and OAF. Hope I am clear. This is the later stage, this is the early stage, this is the confirmation, and this is the symptoms. Okay. Now, confirmation, once we get the confirmation of OAC and OAF, then there is a clinical examination we do. We have done the signs and symptoms, then we'll do a clinical examination like inspection of the extraction site under sufficient light, reveal empty alveolus. Patient is instructed to hold his nose and gently blow while examine the area of suspected perforation. Patient is instructed to hold his nose and gently blow. When patient is blowing, we will examine the area of suspected perforation, जहाँ पे oral antral communication हुआ है. We'll examine that area. And there is a nose blowing test and there is a cotton wool test done for this procedure to confirm OAC and OAF. Okay. OAC or OAF may be associated with acute or chronic sinusitis. Now, intraoral examination. If there is a visible polyp, we go for occipitomental, OPG, CT or CBCT. And it result in discontinuity of the bony floor of maxillary sinus. Okay, if there is no visible polyp, then there is visibility of या तो large fistula या तो small fistula. If there is small fistula, then we will go for IOP and OPG, and we will see disruption of the border of sinus. And if there is large fistula, again we will go for occipitomental view, OPG, CT and CBCT, and we will see the discontinuity of the bony floor of maxillary sinus. In small fistula, there is disruption of the border of sinus. In large fistula and visible polyp, there is discontinuity of the bony floor of the maxillary sinus. Okay, here there is a disruption, here there is discontinuity. Now we will see what happened in all these two. Coming, discontinuity of bony floor of maxillary sinus in CT, CBCT, OPG. It is seen in large fistula or visible polyp. So there are two things. There will be irregular increase in opacity on the inner aspect of the wall owing to mucosal thickening, or there will be a total opacity within the ipsilateral sinus. या तो थोड़ा बहुत opacity होगा जो कि mucosal thickening दिखा रहा है, या total opacity होगा sinus के एक wall पे. Radiolucent shadow obvious in the central of the antral cavity following the shrinkage of the mucosal lining. Obviously वो thickening हुआ तो shrinkage होगा. Then sometimes the opaque zone is limited to the base of the antron due to initial collection of fluid. This is the case of acute fistula and this is the case of chronic fistula. Okay, when radiolucent shadow obvious in central of the antral cavity following the shrinkage of mucosal thickening, this is chronic fistula. And if it is opaque zone is limited to the base due to initial collection of fluid, then it is acute fistula. Okay, these are the radiographic signs and symptoms and clinical signs and symptoms and presentation of OAC and OAF. I have discussed in detail of all these. Now we'll discuss the management and treatment plan in next class. Till then, like, subscribe and comment. Bye.